heard it, they've already forgotten it, so I'm going to repeat it so that we are sure that we are all aware of what dementia is mainly, okay? So, do you think dementia is a disease? Yeah? How many think is a disease? You see?
Dementia itself is not a disease.
Exactly, yes. So, dementia itself is not a disease. Okay, so I'm glad that the people who were here before, they already knew that, because if I saw that hand being raised, I would say, you are not listening carefully. So dementia is not a disease, okay? So let's clear that firstly. So dementia is a condition. It's caused by diseases, like it can be caused by Alzheimer's, then it's Alzheimer's-related dementia. It can be caused by Lewy body, then it's Lewy body-related dementia. It can be caused by stroke, then it's a vascular dementia. It can be caused by something else that happens frontotemporal, then it's frontotemporal dementia. But it's a disease that causes the dementia symptoms. Dementia is a condition. It's symptoms that are presented after you had some type of a disease. Okay? So there are more than 200 types of dementia. We've already mentioned like 5, but there are more than 200. Most of them, number 1 is Alzheimer's, number 2 is mixed, and then we have Lewy body, frontotemporal, everything else. All right? So what we're going to discuss today is behavior and unmet needs. All ready? Or have to go on? Okay. If anything is triggering like a bad emotion or anything, please let me know. I mean, you can dementia-related behaviors, yeah? Can everybody see? Is that okay for everybody? Yeah? Let me turn this like that. The term dementia-related behaviors, so it's used to describe a very large group of symptoms. And they are associated either with Alzheimer's or other dementias. So it's not just Alzheimer's that presents behavior. Mainly, I would say it's other dementias, to be fair. As dementia progresses, the people change. Their character changes because several parts in the brain get damaged, so their character is changing, so they're behaving differently, okay? And even the taste changes, the way they see things, the way they see like their orientation, everything changes. Like most of the things, let's say. Their inner self is still there until the day they die. This is what science says. That doesn't go away, but many other things might change. So once you know the purpose behind any behavior, then you can meet that need. So, when somebody is presenting a behavior, there's always a why. Why? Why? What's wrong? Something's wrong, and they cannot always communicate that. So we need to know that person so that we can identify what they are trying to communicate. Otherwise, we won't be able to identify that. So, as personality changes, those needs are changing as well. So, they might previously liked chocolate. They might not like it now. If I start liking chocolate because I don't like it now, something might be wrong with me, right? Why do I like chocolate? Something's changing. Why? Or some serious things that they would never, ever do. Like, for example, when a person with frontotemporal dementia might start talking sexually, like literally speaking sexually, and you would say, this 92-year-old woman has never before in her life talked sexually. That's not mine, is it? It's okay. Has never before talked sexually. Why is she doing it now? It's not her fault. It's just that part of the brain is now affected, and she's like started to present that behavior. Okay? We will talk a bit about that and what we can do about it. So what are the symptoms? I'm sure you can identify some of the symptoms here. So it's disturbed sleep. How many of your loved ones cannot sleep very well at night? If you can raise the hand. 1, 2, 3, 4, 5, 6. 6. So this is quite a common thing, that people cannot sleep well at night, or they are feeling emotional distress. Why would they feel emotional distress? Why do you think?
They're confused, they know something's changing, but they don't know why.
They don't know why, and they don't know how to
Express
themselves, and they don't know how to deal with it, what to do with themselves. The minute they realize it, sometimes they forget it. That also will cause emotional distress. They will feel agitation. How many of you are dealing with agitation? 1, 2, 3, 4, 5, 6, a bit more, yeah? So, agitation is again something that might have caused them to feel, uneasy, like a new person. You change their bed, you change the room, they can't find the room, they used to go there and you moved it there. Agitation. Walking up and down, pacing, going up and down, up and down, up and down. You experience that, yeah? You too. This is also quite common. They're going up and down. I do that as well. If I leave somewhere my phone, then I go up and down because I don't have the other phone to call me. I go up and down and I go into the room and I'm saying, what am I doing here? And I'm leaving. But that's not dementia symptom. That's any typical individual who just, has too much in their brain. Dementia is if I do that all the time. I'm going up and down, or I'm trying to do things like that, like holding that, or holding this, or the bed sheet, or the blanket, or anything. We call this fidgeting. Walking with purpose. What does this mean? Who knows what this means?
They have a destination, they're going somewhere.
Yeah, but how do you call it usually? Wandering. So because I don't like that word, it's very like, it degrades the individual. So because they know they're not wandering, so they're not out there going somewhere and they don't know what they're doing. They're out there and they have a purpose. Like they know what, for example, I'm going to pick up my kids from the school. Yeah. But your kids are like, 50 years old. They have kids. No, I'm going to find my mom. I'm going to my old house. I'm going to, whoever. I'm going to my shop. We have that very much, In reality. So as you know, dementia will change the way people are looking at reality. So you might be in 2024 and they might be in 1950. Maybe 1970. I had a client who couldn't remember the second husband that she married. I said, well done. But, she could not remember him. And she did not, she would love her first husband that she despised and divorced. So, dementia changes you. It does change you. So, and it changes your reality. So they might tell you, I never told you that. Or they might think somebody's trying to steal from them. You took it from me. You hid it. And you said, but I didn't. I've never done it. And you said, no, you took it from me. And I know that for a fact. And you did that. And I see many of you know that. So, or they think that you asked them to do something. And you said, I've never said that. I've never even once said that. When did I ask you that? I never said that. And then they might have delusions and hallucinations. Do you know the difference between delusion and hallucination? Yeah? So what's a delusion? Delusion is, does anybody know? So, delusion, yes, it's a full belief. Yeah, a false belief, but you definitely believe that that's a fact. Yeah. Hallucination is you see me holding a baby. Yeah, I had a client with Lewy body dementia. That's the most common dementias that present hallucinations, and they were or Parkinson's, and they were thinking that there were Japanese soldiers in the room every night. So yes, that's hallucination. Delusion is firmly believing that something is true. Yes. maybe a bad dream, or if that's a hallucination, are they seeing somebody? If they are seeing somebody in the room, then that's a hallucination. If they think something really happened, that might be a delusion. If that's not a continuous story of their dream.
So can I ask, if they're seeing something, like you said, like the Japanese soldiers, is that from like a past memory that they actually were in the war?
Not really.
Or they just make it up?
No. A lady, before I became a care manager, I was a living care professional because I told you I have a nursing background. I'm a nurse. So one of my clients, she would ask me, do you now hold twin babies in your arms? I would say, no, don't. She would say, oh, okay, I'm just imagining that. She knew she was hallucinating. So she would understand. She would say, oh, I'm just imagining it. And then aggression. Any physical? Who is physical too? Verbal? Yeah, verbal is more common, yeah? But physical as well. So we will explain why, what triggers those, and what we can do about it, okay? So, the triggers. So, top of that, pain. Pain they cannot express, they are feeling it, and it's bothering them. I know that if I get to have symptoms of dementia and I have pain, because pain generally just gives me discomfort. I'm not like saying, oh, my head is in pain or this is it. I generally feel discomfort. I don't feel that actual pain. So that's also a discomfort. What could be a discomfort? High temperature, low temperature, being cold, being warm, being sweaty, being thirsty, being hungry, and being unwell. Something's wrong with them physically. Yeah? And then it's confusion. Confusion can cause this aggression because I went into the room, I'm going like that, yeah, and what am I doing here? And then I get upset and you're in front of me, and then I take it out on you. Because I don't know what's wrong with me, so you should know what's wrong with me. But you don't know what's wrong with me, so that causes the aggression. And then the UTI is a massive, so if we have somebody confused or shows like unprecedented behavior, the first thing we ask the care professionals to do is we need to check if they have a UTI. This is number one. I would add it, I would put it ahead of everything, like ahead of pain, but I will follow the, what science says. So if this is what the research says, then this is what I'm following. So UTI is the top common thing that we see. If they get very confused and you say, what's wrong with them? And that could also cause falls. And any infection, chest infection, any infection, ear infection, whatever, that would cause them to. Boredom, they don't have anything meaningful to do. They have nothing meaningful for them, not for you, for them. Like, oh, I like going out for a walk. Okay, Mom, let's go out for a walk. I don't want to. I don't like walking. I don't want to do that. What do you like to do? I want to draw. So we had this client, and she is a researcher. And she said, what do you think I am? Take it away from me. She was so upset, she literally threw the care professional out. And she was right. I said, why didn't you ask her what she wants to do? Why did you go ahead and just gave her something so meaningless for her, Activities. What are they involved in? What do they like to do? That's why we ask so many times, what's their history? We want to know a bit about them so that we can understand what makes them happy. Noisy environment, loud TV. Take them to your child's birthday party. It will kill them. All that noise, confusion, so many people asking them, how are you? What are you doing? Their children bringing their children in the house. And you say, what? You don't want your grandchildren? No, they don't at the moment because they cause a lot of confusion. If you bring them like 1 by 1 or 2 by 2, that would be easy for them to handle. They cannot deal with it. We have to accept it. Dementia is not a condition that we need to say that somebody is sick or abnormal or there's something wrong with them. Dementia is like saying somebody doesn't have his left leg. What would you do with that person? Wouldn't you accommodate for them to to enter this room? Wouldn't you accommodate for them to go there or do something? You need to treat it like a disability. You need to understand that's as far as they can go. All right? And then new people. Bring somebody new in and changes. Sometimes new people are good, but most of the times changes don't work well. You need to have consistency, stability, and the same people coming in, and a very high routine. Changes in the environment. If you take them from the house and put them in a care home, or you put them in a hospital because they had an infection, disaster. Right? How many times have we seen people like shouting in hospitals, and you said, he's not like that. Or, are you sure? My dad was shouting. Never. He's never shouting. You know, but they will start shouting. They will not feel comfortable because they don't understand and don't remember anything from that environment or why they're here. Why were they there? And sexual frustration. I'll tell you something. So, when you live with dementia, you might think you're newlywed. You're newlywed. So we had this gentleman, it was like 4 years ago, in a previous company I was working, and he was very frustrated because his wife wouldn't have sex with him. And he would shout all day. And his wife was telling him, you had a prostate operation. Even if we wanted to, you know, this is not what you're thinking it would go. It was, I know it was so tragic, it was also funny, you know, but he was feeling sexually frustrated. He said, what, don't you like me? He was saying, but we just married. And she was saying, we have children. They have grandchildren. We have grandchildren. So they live a bit back. They are not living like always on today. They are living a bit back. Not on the onset, but maybe later on. Changing in viewing reality, we talked about that, but also sundowning. You all know what sundowning is? So when the sun starts going down, behavior starts raising, and that's a fact. We don't know what causes it. It's just when the sun goes down, that behavior is exploding. And I will tell you what you can do about it in a few. Embarrassment, they feel embarrassed. They don't want to say they live with a condition. Although when you actually say it, you live better. When you actually say it and share it with your friends, you tend to live better. New medication, when you're giving them a new medication, something changes, maybe hormones or something, and the chemistry in the mind goes off. Misperceived threats. So they think you're threatening them, or somebody else is threatening them, or they mugged them. There's a burglar in the house, stuff like that. Yeah. A client of ours, she hasn't worked for the past 20 years. She thought that she was out on the street and somebody stole her bag. And hospitalization. Has anybody experienced their loved one going into a hospital and getting all, yeah, very much so. So recognizing and identifying what the unmet is. That's the most important thing. Why are they feeling confused? What triggered that? What's the trigger? Is it the environment? Is it because I left them alone for I don't know how many hours? Is it because they ate something different? Is it because the carers that were used to come are different? Is it because I changed the room? Is it because I asked them to do something? I changed the routine? I didn't give them the same cutlery. I didn't give them the same plate. I didn't give them the same glass. You need to have everything the same every day to save them. That's what you need to do. And also, care professionals, but also you, as family carers, we all have responsibility to keep people safe and well. We all have this responsibility. It's our duty. This is our duty, unfortunately. So, unmet needs and tasks of everyday life. I'm sure some of you must have experienced some of that. So, a person is thinking they have eaten, they have showered. Hello. Hi. And they have not, but they are convinced they have done it. And you're telling them, you haven't had a shower. Dad, no, I've had a shower, but the shower is dry. I've had it. They're convinced, yeah? I can see you nodding. That's something typical, isn't it? Especially the personal hygiene. Most of them are not doing it, not because they're bored, but because they think they've done it. Unable to express the need to eat, drink, or to go to the toilet. They want to tell you they want to eat, but they cannot. This is a more advanced stage, and they will go up and down. That's when they will start pacing, or they will feel upset, or they will throw something, because they can't tell you, this is what I want. Because sometimes they will tell you, give me that fork, and they mean the paper. Give me that table, and they mean the tablet. Okay? I think you need to risk assess more this full thing here, Claire. So they are confused about how to dress or choosing the appropriate clothing. So they wouldn't know what to put on first, if it's backwards, if it's like the other side around. They wouldn't know how to do that. They are looking at the clothes, they know what they are for, and they're not sure what to do with them. So that would cause some of the unmet needs, yeah? Or wearing the same clothes, declining to change. They say, it's clean, but I can smell it. No, it's clean. Difficulty in shaving, maybe, combing the hair, or some of people want to put on makeup, all that. They might find it difficult, or they might be shaking, especially if it's Parkinson's-related dementia. They might be shaking a lot of tremor there. Unsure what utensils to use. That's why I would always advise, let's say, to use like colorful ends, those colorful plastic ends, so that they can notice that. And always the same. Always the same.
Colorful what, sorry?
The plastic ends, and look, if it's white or like a silver thing, or they will not always be able to see it. They will not identify the object. It's because, do you remember we discussed about in the previous course that they will have difficulties with vision and how to understand what they are looking at. Yeah. So, what would be a safety concern when you have a loved one and they are on the onset? For example, if they're receiving letters that are action required, urgent, it means that they are telling you they are taking care of things and they are actually not. This is what we tell the care professionals. If they see any of that, like having like final notice or anything, we tell them notify us because something's wrong. This person might have thought they paid it and they haven't. Or something else might be going on, maybe financial abuse, I don't know. Overpaying or forgetting to pay bills. I will tell you something. One of my previous clients in the previous company, he was extremely wealthy. He donated 500,000 within 6 months. And then his bank called us, didn't have a diagnosis. And then the family took him, they got a diagnosis and the power of attorney, and then explained that, look, you can't do that. Because he forgot, he was donating 12,000 every year for his wife. And he donated so many times. They have his statue, I think. Now, I don't know if they returned it, but yeah, it was done accidentally. Imagine that. Overpaying or forgetting to pay the bills, yes. Drinking, cleaning fluids, thinking it's water. You need to protect them. You need to have that in a safe space because they might think it's actually water. They will drink it. Because they see something and they switch on the cooker and they forget to turn it off. Has any of you had that before? Yeah. They forgot to turn it off, yeah. Placing a fork, for example, in the microwave, and the microwave explodes. Yeah, we've had that a couple of times. Everything on the list, we've had it. So in case you're wondering who's doing that, many people are doing that. Okay, so if it's your people who are doing that, it's also many other people who are doing it. So don't feel like it's something different. Placing unsuitable items in the washer, dryer, or the dishwasher. Stuffing a plate, for example, in the washing machine or the dryer. That was a success because the plate broke, and then some of the small things went into and then they had to replace the entire machine. and lock the room. Forgetting to take medications, this is very common. Yeah? You visit them and they say, you said, did you take your medication? And then you check the blister pack and you say, no, you didn't. You didn't take your medication. This is the main reason that we go to people's houses and support them, especially in the morning, because they will not take the medication otherwise. That's the truth. Arguing with people. Like starting arguing because, first of all, they forgot the conversation, they think they threatened them, they were experiencing any type of confusion, and they start arguing with other people. Have you ever fought with somebody and then you thought, maybe he's like, or she's like, she has an issue? Have you? It has happened, yeah? Hiding things. Now I can see heads. Who is hiding things? Now, you, yeah. Hiding things. And then they said, somebody stole it from me. Where is it gone? Where has it gone? Why did it? Or keeping things, like a lot of stuff. They refuse to throw away things. I mean, I'm doing that sometimes. Yes, Debbie?
I just wanted to say about the medication, also quite a number of people have said they take more than.
Yes, overdosing.
Yeah.
Overdosing.
Yeah.
Yes, exactly. So, either they are underdosing or overdosing. So if they miss the dose and they have a UTI, for example, they will fall. If they overdose, of course, we contact 999, ask for help, all those things that we have to do. So how can we manage that? Okay. Number one, we need to resolve that. Are they in pain? We need to manage the pain. Give them painkillers. Speak with the doctor, of course. You don't just medicate somebody because they might be taking other medication that they're not allowed to take a painkiller. For example, if they're taking anticoagulants, they should not take ibuprofen, right? They could take paracetamol, for example. If they are taking another type of aspirin, they should ask the doctor before taking paracetamol. So you need to always consult with your GP. Arrange urine blood test called GP review medication. As I told you, the first thing we do is to resolve if this is something that's causing that. Is it constipation? Give them some fiber, like senna tablets, maybe salad, fresh salad, or some type of fiber you can do. Maybe see if they are with depression or anxiety, and then these could cause actually a lot of triggers for unmet needs, behavior, aggression, agitation. Yet, we are not sure whether depression can cause dementia or dementia causes depression. Definitely, we understand they are both very closely related. And because somebody is living with dementia, it's so hard to diagnose the depression. Because some of the symptoms are very, similar, right, to depression. And then you need to put yourself in their shoes. So you need to be empathetic, understand how they are feeling at the moment so that you can understand what's wrong with them. And then maybe it's too much noise, lower the television. I would close it, for example, unless it's something fun to watch. And use your knowledge of their life and habits. So whatever you know, because in the end of the day, every person is different. So what causes me anxiety wouldn't cause you anxiety, right? We are different people. I'm comfortable speaking in public. If we put Claire right here, she would need support, me tapping the back, you can. So not everybody is comfortable with everything, so we don't know what they are comfortable with, yeah? Simone could, right? So we need to understand how everybody's character is working. That's why life history is so important. And sometimes we go to assess, and we are asking all those things, and the relatives, all the family members, will say, "But why are you asking all that? This is, it's personal." Yeah, well, yeah, it is personal because this is a personal thing. So understand their reality. Where are they? Do they think the parents are still alive? Do they think their children are still young? Because then they might see the children and they will not recognize them. Because they think they are 6 years old and now they are 50 years old. How would they recognize them? They wouldn't. try to find out what they are trying to communicate. This is the hardest job. To find out what's wrong. Why are they upset? Try to find out. And do not contradict. What does this mean? I'll give you some examples. Claire, can you come over here? We can use some examples now. So if we say, I do not contradict, what do you understand? What do you understand?
Don't try and correct them.
Yeah.
Don't try and correct them. Don't argue. So what do you say?
Go along with it. Appease them.
Just walk away.
Walk away. That's also correct.
Yeah.
It's better to walk away than to say, but you're wrong, right? So I'm telling you, you took my purse. So that's contradiction. What would you say? You took my purse.
Okay, we'll have a look for it, or okay, I'm really sorry, let's find out where it is.
Yeah. First of all, number one, what do we do when a person living with dementia says that we did something?
Agree with them.
Agree. Then, number one, apologize. You need to apologize for everything, for doing something, not doing something, for your existence. Yeah? You need to literally apologize. Say, I'm sorry. This is, I know that because at that moment, their reality is you took it. So you have to accept that. So I understand you're feeling that way. So we go here. Put yourself in your shoes. So you say, I understand you're feeling that way. So you think I took your purse. I'm so sorry for that. Maybe it's somewhere. Let's find it. That's how you manage that.
What do you do? They say they're going to the police.
So if they say they're going to the police,
Right there.
yeah, you say, do you want to call the police? Yes, please. Let me help you. Do you want me to drive you there? What do you want to do?
Yeah.
And then they say yes. Okay, let's do a cup of tea. I'm going to make sure that the car is set. So you must redirect until. And then you say, but before we go to the police because they're so busy, let's try to find it.
Yeah.
Okay? So many of the care professionals in the beginning, when we were doing this, like, let's say, discussion and guidance, and I would do the same with Claire, and they would say, I would tell them, no, I didn't, but we can look for it. I said, no, you don't say you did. They say you did it. So you apologize first, and then we will decide what we need to do. Okay? Yes?
Isn't there a degree of balance in that? It's a bit like if you keep feeding the beast, maybe the beast will get worse.
I'll tell you something. If you actually find that person, or if they remember, because at some point they will hear and they will remember, or they will forget it completely, because you cannot change them. They will not change. So who has to change? You. Us. Right? The environment. Then what does that make?
What I'm trying to get at is, although they won't change, they can get more within. I'm thinking like if you keep on failing.
You think that this will cause more behavior? No,
No,
because later on, when they realize that, they apologize. Sometimes they do apologize. You've had them apologizing, I'm sure. They've said something, you said, oh, why did you do this? You made me sad, because you're the family, and you're allowed to say that. You made me sad, you made me angry. You're allowed. We're not allowed, but you can. So you say that, and then they say, oh, I'm so sorry, I thought it was not here. And then again, they will complain about the same thing, which is what dementia is all about. This is the symptoms. Okay? They will not change. That's it. They can change slightly, but not as much as so that they will never again repeat it. Yeah?
Although it's not going to stop that incident happening again, it's actually going to stop that escalation happening.
Yes.
Because we all know how we feel when we get worked up. You can feel it, can't you, rising in you?
Yes.
You think it's to try and kind of, isn't it, and calm the situation
Yes.
at that point. Doesn't mean it isn't going to happen again. It's how we cope with the situation.
Because not contradicting and calming the situation down will help not only the person but you as well. Because you will resolve it quicker, and then you will be fine. Because you cannot win that argument. You will not win that argument, I'm afraid.
there's such a thing as should never argue with the person.
That's it.
The more you argue, the worse it gets.
Yeah, do not contradict, ever. That's a gold rule. Golden rule from Edward. So reassure them with relaxing, simple phrases. Simple, like, do you remember, so if I say to Claire, so do you remember she's having some kind of an issue, right? And she's being, trying to find something, or is agitated about something, or something she believes that happened. And then if I say to her, so Claire, do you remember when I was here last Monday and I said that, and your purse was here, and then we took it there, and then I lost her. So what I need to say is, I'm so sorry, let's try and find it, and then try to calm that person down. Because if you are calm, can you think straight? If you can. If you are not calm, can you think straight? You cannot. If you are not calm, you can't think straight. That's it. So you need to reassure them and say, don't worry about it. We'll try to find it. I understand how frustrating this is for you. You literally say that. Can you repeat that for me? I understand. You? Yes?
Yeah.
I understand how frustrated this may be for you.
I understand how frustrating it might be for you.
Exactly. So you need to say that. And then you need to say, I'm so sorry, let's try and see where it is. Maybe I put it somewhere and I forgot. Blame it on you. What will change? I mean, if you take the blame, what will change? Right? What will change? Nothing.
Doesn't it sort of tend to encourage them to almost like rewarding bad behaviour, if you know
It's
what I mean?
not.
No.
Does it encourage them to distrust? Like, so my dad's got a really big thing about distrust, and he distrusts me and my mum quite a lot. So if we're saying sorry all the time, and saying yes, it was us, is that going to make him distrust us?
You don't say
It was
yes, I
more-
took it. You
Yeah.
say, I'm so sorry, I understand this is frustrating, let's find it. You don't say, yes, I took it. There's a difference. You don't say, I took it. You don't, actually,
Acknowledgement of what's happened.
Yeah.
yes, exactly. So you don't say, I did it. You say, I'm sorry, let's find it. You acknowledge that this has happened, so you validate that emotion at the moment. If you don't validate that emotion, they will remain upset, they will remain upset.
But it's not just a matter of talking or telling the person. You facially, they look at your facial
Yes.
remarks.
Yes.
Very important.
Yeah.
They can see if you are angry or upset.
It feels almost like a sense of sort of almost role play.
Yeah.
It's almost like
It's like when the nurse comes in your room and you're in, absolute pain, and you are like not feeling very well, and you ask the nurse, oh, hello, good morning, how are you? And she says, I'm fine, thank you. Is she? Is she?
you've got to. It's like that situation, like she's being what's needed.
Yes. So if the thing is that the family, until they realize that they are the carer, it takes a while. You actually become the carer if you're caring for that person. It's hard, isn't it? It's hard.
You have to be really skilled, actually. Yeah. And you feel like you fail sometimes.
So that's another thing. It causes a lot of guilt. All family carers have guilt because eventually you might get, frustrated. You might say, oh, can't stand it anymore, bang the door, leave the house, do whatever, and then you regret it. And you feel guilty, but no matter how many times I'm telling you it's not your fault,
We're going to blame ourselves.
this is human. Even us as professionals, we blame ourselves all the time. We feel guilty of so many things, anything that happens because of somebody, we feel always, because this is what caring includes, let's say. It's not what it's all about. It has so many rewarding moments, but it includes that. But mostly for the family people, the family members, you can feel a lot of guilt. Do not ask direct questions. Do you understand what we mean? Can you give me an idea?
When you say do not ask direct questions.
Literally.
Literal sense.
In the literal sense.
Do you want a sandwich? That's direct, no?
Yeah.
Yeah.
Yeah. So, you okay?
Yeah.
So, there is a sandwich for you I'm going to prepare and put it in your plate.
Okay. Rather than saying, do you want a sandwich?
So if you say to them, do you want to have a shower? No. If you tell them, I have all your clothes ready for you to have a shower, and then suggest you say stand up and start going to the shower, it's actually consent, yeah? They're consenting. If you have a plate and you hold that fork or whatever, the sandwich, and you tell them, do you want a sandwich? They say no. That's not consent. You cannot give the sandwich. That would be force feeding. But if you hold it here and you say, I have prepared this lovely sandwich for you, and they take it, or if they open their mouth, and that's consent. Do you understand the difference?
Yeah.
If you tell them, where do you want to go? Don't know. If you tell them, we are going to go to the church today. We're going to go to the temple. We're going to go to the garden. That's a different thing. Okay? This is a different thing. Or, okay, let's put on your coat and we're going to go to the garden as we said yesterday. If you ask them, would you like to go to the garden? No. So if you ask them, do you remember Pashalina? She was here yesterday? No, they don't remember me. So what you need to say is, this is Pashalina, she was here yesterday. Accommodate that loss of memory, accommodate it. So if you say, do you remember we had chicken yesterday? Why did you ask for chicken? What you can say is, we had chicken yesterday, so I thought we might have some beef today, right? I thought we might have some imam, which we call a vegetarian meal in Greek today. Okay? So you can do that and suggest. Yeah, this is the hardest part. That's why I left it for one of the.
I'm trying to map it to like the why bit. Is it directly towards memory?
Because a person living with dementia, especially as it advances, they cannot have that answer when you ask it, and they might want to say yes and they will say no. It becomes confusing and overwhelming. Yes, Debbie?
Doesn't it impair sometimes their ability
Yes.
to make a choice?
Yes.
So therefore they just say no.
Yes.
That's easier than having to think about what choices there are.
Don't put them in a position where it's like you've got to make a decision.
Yes,
Yeah.
exactly. And they will not respond in the way that you would expect them to respond, because they do, in that moment, they feel attacked and they say, what's the easiest thing for me to say? They might say yes or no, but usually they will say no.
I think for my partner often will say yes to something just
To avoid the question, to get done with it. Yeah. So they might say either, but this is not what they want. Well, that's why you need to know your person, and then you need to say, I know you liked going into that cafe. It would be a good idea if we went today. And then they will just consent. But you give suggestions. I will speak about that. Reducing the noise and distraction. I cannot say this enough. Big family gatherings. Greek people with dementia, they suffer. We are like doing massive. We are horrible. And we shout, we talk loudly, we make all these that I'm making all this time, all these gestures and everything. A person living with dementia suffers because we are like that. So until we understand that, we need to understand it. Yeah? So then,
The only trained professionals go up to on dementia ward, basically give the patient a menu and say, what do you want for, and there's like 15 dishes on it. What do you want for dinner?
this is wrong.
Yeah.
This is wrong.
Yeah. I mean,
I'll tell you.
They say to me, what I said, what she ate today?
Yeah.
Oh, she had a sandwich. Well, why did you give her a sandwich? Because that's what she said she wanted. We asked her.
Yeah.
This is the topic.
Because she would, sorry, yes, go ahead.
Actually, it was Northwood Park. And I said,
Yeah.
I actually literally almost hit one of the staff because they were.
That's not allowed in this country.
Like how bad it actually was.
I understand.
Because I found out that that was bad. That was the least of it. That they, in the middle of the night, they'd woken her up out of her sleep and were giving her the massive injections inside her.
Well, I'll tell you something. So, the way that these facilities are set up, of course, there is not enough staff to treat, it's not their fault. If they had like a person to deal with every person living with dementia, that would be different. Do we have that staff now? No. If you're asking me, they are understaffed. Everybody knows that. I mean, it's a common thing to say. But if, for example, they're in the house, then you have that ability to give them that type of choice, not like the direct question. Because if you say, would you like a sandwich? They might say yes, because they don't know how to say, no, I'd rather have a lamb roast. They don't remember the name, they are confused, they can see it somehow, but they can't express it, all those things. Right? Spend time with them, like sit down and say, okay, tell me. Let's discuss something. Use photos, like take a photo album, open the photo album and say, okay, now here is you and me, and this is the children, and this is that, and this is that, and then go ahead. Or open a screen, but if the screen is like where you're sitting and the TV is here, they will not watch TV. If it's here, if I'm sitting here, I might watch it. Because if it's far away from me, I have other distractions. I will not watch it. Involve in meaningful activities for them, not you, for them. Yeah, I repeat that. Because we all do that. We sing music, but they don't like it. There are some, in YouTube and Spotify, there are playlists for people living with dementia. They're really nice. You should try them. Even with headphones, music resolves many of the things. Emotions are important, so you need to validate that emotion. We said that before. They tell you, you did it. They believe it. You say, I'm sorry, I know it's frustrating. Let's see how we can fix it. You don't admit that you did it. You just say, let's fix it. Let's fix it. It's a bit vague, right? It's hard, especially in the beginning, to try to do that. Especially the do not contradict part. Because you really scream inside of you and you say, I didn't do it. Oh, you are wrong. It's not Sunday. It's Wednesday. Your mom is not alive. You are 80 years old, 90 years old. Your mother is not alive. You cannot say that. Because they will say, I'm going to see my mom. And then what do you need to tell them? What do you need to tell them? What are they feeling when they're saying that they want to see their mom?
Lonely?
Sad? Yeah. Unsafe. Unsafe. That's what they feel. When are you looking for your mom? I still call my mom.
When you're worried.
When I'm worried.
Yeah, scared.
Mom,
Yeah.
Mom and God, or, whatever everybody, has, if they have a belief or anything. So that you're looking for that person because you're unsafe. So first you need to make them safe. You need to say, okay, let's make a cup of tea or a cup of coffee. You literally change the conversation. Say, okay, let's make a cup of coffee. Give them a little hug. Touch them a little bit on the head, on the hand. Just say, do you need a blanket? Are you cold? Just try to make them warm.
Obviously, she wants to go home.
Yeah. You want to go home?
Yeah.
And then you say, okay. What?
Literally says, I want to go.
Yeah. And then you tell her, okay.
Very stern.
Yeah. Okay. You tell her, okay. Okay. Let's make a cup of tea. And then you say, where is home? Where is home?
They can't answer.
And what would help is to always have a photo album next to you. And then sit her down and just open that and say, this is me, this is that, this is your new house, we are in the house now. Not say you don't have another home. Don't say you don't have another home, Mom. You say, okay, let's sit down, I'll explain to you your new house. Yeah. And then you say, I understand this doesn't feel like your place, but this is where you moved in 1970. Okay? And then you need to have that consistency in what you're replying. Consistent. Every time she says that, you need to reply the same two phrases. Consistently.
When she gets that, when we're out for the day or whatever, at the front door she says, this is not my home.
Yeah, yeah.
She's like, doesn't want to sit
Do not contradict that.
No, I just say to her, Mommy, I'm leaving you, this is your place.
Yes.
And then she,
Exactly.
I say that.
That's a very good response. That's a very...
I'm not leaving you, you're not leaving me, we're together.
Yeah.
That's what I say to her.
Yeah.
But she's all the time saying,
Brilliant response.
I don't want to go through that.
Every time you need to say that again and again.
And when Mum asks a direct question, now she'll say, where's Dad? He died last year. It's very difficult.
Did she tell you that? So did she tell you, where is Dad? He died last year.
No.
She said, where is Dad? So what did you say?
I think I said he died last year.
She died last year.
Yeah. Because otherwise, if I try and say, oh, he's
At work.
gone
You
to
say
India, she'll
he's...
say, I'll do FaceTime with him.
You say, he's not here, Mum. And then she say, where is he? And you say, where did he tell you he is? Where do you think he is? That's when you need to ask the question, but that's about it. And then if she goes on, you just say, he's not here, Mum. It's very distressing for you, I'm so sorry. Do you want some time off? Do you want something to drink?
I've had the same thing though, but Mum will then get to the point where, oh, he's dead, and then she'll start crying her eyes out. And she goes through the whole grief cycle.
Because if you tell them they died, it's for them, it's like hearing it for the first time. They do not recall it, that's why they're asking you.
I mean, I've had it where she's gone through the entire family and said, where's my mum, where's my dad, where's my brother, and they're all dead. And, at the end of the day, we're all ready to jump out the window.
Yeah, exactly. This can be very, distressing for them. Do you want to take a break? It's okay. I'm so sorry. I said that here. It's very distressing for everybody because you face it all the time.
Yeah.
And
You
for
can't show that grief to her.
no, you can't. Yes.
I can cry when I'm there.
Yeah.
Situations when I don't want to cry.
Yeah.
I can't even make myself cry.
Yeah.
With
Yeah.
her.
That's it's very, very hard. It can be hard, because you can't show that
To show her
that emotion that you are having. You cannot show that.
Sorry guys.
You don't have to apologise, it's okay.
You never have to apologize for what you are feeling. Please do
Not
that
to us,
favor.
yeah.
Not to us. No. No, it's better that you
Get it
express your
out,
emotions
yeah.
freely. I mean, I understand this is distressing.
Yeah, because it's almost like I haven't dealt with Dad's passing.
Yeah.
Yes.
Your own
Yeah.
grief.
I parked it
Yeah.
because I can't deal with both.
Yeah, absolutely.
My dad, because my brother died, 5 years ago, and my dad replaces his grief for my brother with his granddad dying.
Yeah.
So he'll, if someone asks him, like we went to see a psychiatrist and they asked him about my brother's death, but my dad then started talking about my granddad and was crying about my granddad. But I knew that he was talking about
your
Marcus.
brother.
Yeah.
About his child.
Yeah.
Yes. So this is something that can happen because that's what view of reality is all about. Their view of reality is not your view of reality. So you need to just this is the hardest part of being a carer, a family carer, because you need to accept that different reality. And that can cause a lot of distress for yourself. I will talk later how you can support yourselves. Because you are doing the hardest, like weeks for a break, and we can't get back on our feet, and you just are there all the time. It's hard. So, when we validate their emotions, it means that we understand them. We feel that empathy. We understand how they are feeling because they cannot avoid that. They cannot avoid it. So we need to understand it. And sometimes we are not able because we have to face our own emotions, for example. We have our own history to deal with, our own feelings at the moment. That makes it quite hard. Make everything simple. The routine. A simple routine. Get up in the morning, have it every morning, every single time. Get up, wash, breakfast, dress, go out for a walk or do this or do a routine. The same things. Sit on the same side of the table, use the same cutlery, everything the same. Have everything the same. If you're going to change that routine, expect like,
Backlash.
you know,
A reaction.
A reaction on the next 2 days,
Yeah.
right? You will have that. If you change that routine, they will have a reaction. Yes?
I was away for a week.
Yeah.
And my partner's son and daughter moved into the house, and he had 2 or 3 days he didn't recognise them.
Yeah.
Didn't know who they were.
Yeah.
Strangers in the house.
You know, he got really aggressive.
Yeah. He didn't know that these were his children. Yeah. Yeah. And then it took him so many days to recover because he couldn't have that, change. They don't deal well with change because it's hard. Already, a certain routine is already hard for them. A routine is already hard for them to follow. You need to sometimes tell them, okay, so for example, we will do a session for eating and drinking, but I will give you an example. So sometimes you have to say, okay, this is the fork, and you hold your own fork, yeah? You say, okay, now hold that and put it in your mouth, and you hold your fork and you put it in the mouth, and then they cannot do that. Sometimes they cannot even do that. So you need to understand that they are seeing things a bit differently. Not always, okay? But sometimes, and it depends on the stage of dementia and the stage, how advanced their dementia symptoms are. So use labels. It's not a bad thing. Inside your room, say, this is for Shalina's room. VC, kitchen, cupboard, like coffee, whatever it has, big letters, right? Use a whiteboard. It cannot be white and black at the same time. I had to choose. You see how hard it was for me to choose? I could not even choose if it would be white or black. So use a whiteboard. Just write their schedule for the day where they can go and refer to it. They can go in and you'll say, okay, the date is this. 10 o'clock breakfast, 11, this is breakfast, this is your lunch, this is who is coming, you do that.
And if they're struggling with words, maybe pictures.
Yes, that's a very good idea. Maybe photos. For one of our clients, we had to go and do a board with the photos of the care professionals who were going in and their names. So every time he would go in and say, oh, this is, and you would say, that's me?
Yeah.
That's me. I cut my hair, for example. That's all, right? They might feel agitation because they don't recognize your face, and they might even start pulling a knife or doing things like that. And we will discuss how you can manage that, okay? We had some recent events that we had to protect everybody, like the person, the care professional, and everybody. So use photo albums. I say that so many times. You cannot believe how reminiscence, how important it is for them to understand where they are in time, who their loved ones are, and what they are doing there in that house that sounds so strange and so different. Music therapy, I told you, aromatherapy, massage, objects to use, yes.
Can I just say something with the photos? At home we have a digital photo frame.
Yes.
So my mum quite often looks at that. So
that's very good. Yes, that's a very good thing if you have a digital photo and those photos come again and again. But also aromatherapy is so nice, If you smell something nice, Even a cake baking, doesn't it make you feel nice?
Yeah.
It's all those hormones, that the dopamine that goes in the brain, and you feel so happy. So that's what aromatherapy does. And music is important. A massage will do them good. Like soft objects, if they are like doing a lot of pacing or holding things and they don't know what to do with them, or they don't know what to do with themselves, we had like soft little bears or rabbit or whatever, or there are some blankets for people living with dementia that are very helpful.
Yeah.
Very helpful.
The fidget blankets.
Yes.
Right? Yeah.
Physical activities. A physical activity will keep them calm and tired, and they will sleep better. Me gardening, I would be so agitated. I can keep people alive. Plants, not my thing. Yeah. So you want a plant to stay alive? Away from me. You want a person to stay alive? I'm quite good with that. But a plant, no. So if they took me gardening, why did you bring me here? I would be so. But if they like gardening, do that. It's a very good exercise. Or walking, or even if they're with a wheelchair, walk them with a wheelchair. Anything that they like doing, drawing. We brought the activity books, use them, word search, anything. Ask them to come to sessions, like we will have different sessions that they would be able to attend. That would be more easy. Physical activities, we said, like manage sundowning. So how can you manage that? Limit the light. So this is too much light for such a long time of the day. Especially the summer is the worst for people living with dementia, because the light is for a very long time and they cannot deal with it. So you need to close the curtains. If there is any glare, like this thing would cause them agitation. A mirror, cover the mirrors if possible. I know it sounds strange, yeah? And as I said, keep the environment simple, like fewer furniture, not very destructive carpets.
Patterns.
The patterns are not helpful. Have a nice evening routine, like a typical nice routine. What do you do at night? Okay, Claire, let's set up the table, yeah? Let's now put on your pajamas. And now we're going to brush our teeth. And now we're going, so we, not you, do that. We say let's do this, let's suggesting all the time something. If you instruct them to do something, no, it will not work. It will not work well. And use physical activities during the day when possible. We said that. Prevent it. Ensure the environment is calm. Remove all the triggers. Reduce the noise. We said all that, yeah? We discussed all that, didn't we? Give them an object to make them feel safe while holding. So if they have an object and they're holding it, they feel always safer. That's something, they are doing something. Have a routine? No, it's not do, it's don't. So it's me, I wrote all that, so I'm sorry about that. So I can recognize my mistake. So don't ask them to remember, remind them. You remind them, don't ask them to remember. Oh, remember? We have to go to, we said that we will, they don't remember, just tell them. Just tell them. Make yourselves feel comfortable about it. They don't remember. Limit caffeine. A lot.
Yeah, just remove it if you can.
Decaf.
Yeah.
Decaf.
And tea has caffeine as well, guys.
Tea has got a lot
of caffeine.
Decaf. Yeah. No bad news. If you come to them and tell them, oh, you don't know, oh my God, Mom, you know what? Uncle Vlad has died. Yeah. They will forget it. They will retain the emotion. They will feel frustrated, upset, agitated. They will not remember what was the thing that actually caused that, and they will be like that, and you will not be able to understand, why are you frustrated now? What's happened? Why are you like that? No news on TV. They make me feel
depressed.
Yeah. And anxious, about the future. I mean, oh God, what's happening? These bombs, or this
We're
happened.
doomed.
It rained, people drown. It's
Yeah, it's too much.
If you want to leave, you tell them on that day, on that moment. If you tell them a week before, oh my God, no, don't. You're never leaving or going. You're always there. You just say, okay, I have to go out in the market now, and you just leave. Don't tell them an hour before that you're leaving. And if you leave on the board, Pashalina is away from that to that, I'll be back, you know, like you, Jill, for example. I'm back, maybe you've done that, I don't know, and your children are coming, photos of the children.
I was going to say, how can you manage that? Because we try to encourage our carers to get an overnight break, a carefree break. But then if the person left behind to substitute the care is dealing with erratic behaviour, how can they manage that?
That's how they can manage that. They need to leave that for them to read. And then if the carer is there, they will bring that and they say, do you see this? This is your wife. This is what she's done. She'll be back. Don't worry, I'm here. I won't leave you alone. You're safe. I'm dealing with you. And with this, do not worry about anything. I'll make you a cup of tea. I'll make you your meal. We'll do this. We'll do your routine. I know your routine. Don't worry. Don't worry. Do not worry. Reassure them. And validate that feeling. Validate it. I understand you are feeling that way. I understand you are feeling your mom is still alive. I understand.
And apologise. Always throw in a sorry.
Apologise.
Yeah.
Apologise not because you did it, so that they can understand I'm sorry you're feeling that way.
Yeah.
That's the apology. It's not I'm sorry I did it. It's I'm sorry you're feeling that way.
Yeah.
So sorry. And this is a nice thing to do. We all should be doing. Like, honestly, understand the other person's emotions, actually validate
I have
them.
to apologise to my daughter probably 5 to 6 times a day, every day.
Teenagers, we apologize for everything to teenagers. They're like, you're breathing next to them, and they're like, you're breathing next to me, and I don't like it, and I told you so many times, I want my space, right?
Yeah.
So, deal with incidents. At that moment, yes?
What is the reason for caffeine?
Caffeine.
What is the reason?
What's the reason? If you drink caffeine, you get more
Active,
hyperactive.
hyperactive.
So, and then you can't sleep at night.
Sleep, I can understand, but you get agitated as well.
Well, I'll tell you what. So, how often do I drink coffee, Claire? Once a month, maybe.
Oh, wow.
Maybe once every 2 months. So I don't like, caffeine does nothing to me except for bringing me palpitations.
Yeah.
So caffeine is not actually the best thing to have, especially if you're dealing with all the other things in your life and you are trying to remain calm. If you want to remain calm, but now I need you to be more energetic, right?
It's also not good in the evening, surely.
Especially in the
when
evening.
you're trying to keep people calm so that they'll go to bed, the last thing you want to be doing is
Boost
giving
of
them something
energy.
which is going to wake them up.
I wouldn't give caffeine after 3 p.m. ever. Yes.
I found those coffee substitutes are quite good actually.
Yeah.
So I
Okay.
do them with milk. They're like barley cup, that kind of
Oh, I see.
Malt drinks,
Holland
yeah.
and Barrett. I don't know what they're made with, but
Okay.
she can't. And sometimes I might just like put a sprinkle of coffee in, so it's really there's
Taste.
no coffee there at all, just a flavour.
What's the name of them? Maybe you can enlighten us. We can.
It's the Whole Earth.
Okay. All right.
It's one of that brand, and it's similar to barley cup, but it's got a bit more flavour.
Yeah.
She can't tell the difference.
All right.
What about drinking in general? Because
Alcohol?
No, not just like even water. Sometimes Dad won't drink at all, and we're trying to encourage him to drink. We'll pour out, or we'll let him pour out. Because often, sometimes if we pour out, he goes and throws it away and gets his own, but then he still won't drink it. So it's
We'll do an eating and drinking session.
Yeah.
Because this is an entire honestly, but yes, you need to encourage them all the time to drink. Yeah, that's one thing.
Because he gets more agitated.
Yeah, maybe change the color of the cup, the glass, maybe change that. Calm tone of voice, so when you're speaking to somebody who's angry, if you shout on top of them, they will get more angry. That's typical. It's not just for people living with dementia, it's
Anybody.
life advice. Survival, right? If somebody is angry, you shout, they shout more, you shout more, that never ends, right? Speak slower, use simple phrases. I'm repeating that many times. Explain that you understand them and you want to help. Physically distance yourself and leave the room if needed. If they are angry at you, with you, and you cannot resolve that at the moment, and you feel that they are agitated and trying to hit you, or they are trying to grab a sharp object, or a gun especially, call the police. If it's a knife, remove yourself. Literally, leave the house, the room, leave. You need to leave. And then you can return like half an hour later and say, oh, hi Pashalina, how are you? And I'll say, oh, hello, where have you been? Usually, that's how they will react. Okay? But at the moment, when you see that you cannot face that, please leave. Physically, remove, distance yourself. Distance yourself. Get out of the way, because at that moment, they cannot calm down. So let them just, let them be. I said that. Physically distance yourself, turn down the volume of the TV, take the person in another room if the room is full of people. So if they are in a room full of people and they feel agitated at the moment or frustrated, or you see that they are not comfortable, just take them. Okay, let's go to the next room. Remove them. Take them to a less noisy environment. Never raise your voice or criticize. You cannot criticize them at the moment, because they are believing what they are saying is to be true. Because this is the reality that we have to understand that. And
sorry, if they're a bit aggressive, and I understand that towards you,
yeah,
the room. I mean, I don't actually have this with my mum, but
yeah,
I'm just thinking if it advances to that.
yeah.
Is there a danger they might hurt themselves if you're not there, if there's not someone there?
This is for you at that moment to understand. So, are they picking up an object to hit you? If they hit you, will you be able to care for them then? No. So you need to protect yourself. If you can remove that object, fine. But if you can't, you need to. So if it's a knife they're holding, you don't go and grab the knife. Who will take you to the hospital? Think how you need to deal with that. Every situation is different. We don't have one plan for all situations, but mainly, if they become too aggressive towards you, coming to you, to hit you, you need to leave.
So last week, I had a situation with Dad that he wanted to. He was giving me his tracker back, and saying it was mine. And I say, "Thank you, Dad."
Yeah.
But it's yours. You keep it. You know.
Yeah.
But thank you. But then he wanted to go out the house, and he wasn't going to take his tracker, and he'll get lost. So.
Yeah.
I went after him with it
Yeah.
and tried to give it to him at the door, and he actually went to hit me.
Yeah.
Because he was agitated
Yeah.
about it. But what do I do in that situation?
You just follow him.
Okay.
Sorry, you didn't like that answer.
But no, it can be hard, can't it, at times, you know.
We follow
Yeah.
them
Yeah.
discreetly,
Yeah.
like James Bond movies.
I could be everywhere, I could be in Hannah.
I'm so sorry. You can't force him to have something he doesn't want to.
Does he need to know about the tracker, or can you
Yeah.
maybe hide the tracker in
No,
something?
because
So we had trackers in rings, you know.
Yeah, but we found, you see, he won't wear anything.
Okay.
And we found that, like, we had an air tag, but that wasn't accurate enough for him. And I couldn't pinpoint him enough. So it's a bit of a bigger one now.
Yeah.
I know.
If he doesn't want it at that moment, you need to just follow. Or encourage him to come back in and say, oh, we forgot something. No, you know you're done.
No. Very determined.
So for the frontotemporal specifically, because they can, as I told you, they can present like either sexual disinhibitants, so they can speak sexually to people without that meaning that they are going to touch somebody or anything, or they might decide to take their clothes off in public. So if you see that at any moment, or if you face that, just please protect that individual. Like, say to the rest of the group, please, I'm so sorry, my friend, my dad, or my mom is living with frontotemporal dementia. She cannot help that. I'm so sorry. Try to, protect them. That's all we can do. All right? And if they are doing that, you need to remove all those triggers that are causing that. And when it comes to like trying to be aggressive, it's because they think they can do it, but they cannot. They cannot do it. So you have to follow, I'm afraid. You didn't like that.
Well,
I'm
it's not that I
sorry.
didn't like it. It's, not, it's just that in every home, and it could be 6 o'clock at night, and
It's hard.
he's getting ready to get on a bus to go to Harrow, and how do I manage?
If you see someone who is behaving that way, that you know that they're out on their own, you don't know them, who's the best person to call to help you with that?
So first of all, if you want to approach that person and say, hello, are you okay? Would you, you know,
and if they,
where are you trying to go, for example? They might say to my mom's house, or they might say anything, and then you would need to call actually 999.
And who's best to deal with that? Is it?
They will figure out who will deal with it.
Based
But
on how they,
yes, unless you know that person, and then you can help them go back home. So many times neighbors are like taking people back home.
Yeah.
Yes, yes.
But then I saw on the outside a police car. So I was thinking, would they notice him and try to help him?
Yeah, they're very good at Dad's bringing, or Dad either goes to the police, or they notice him, and they have been amazing actually, bringing him
Actually,
back.
if you have those issues and you contact the police and let them know that this is my dad, this is his photo.
Yes.
Have always a photo.
Yes.
This is his photo. This is my number. So if you, and at any point, you know, or I'm missing my, he's gone missing. So
They've
this is
been
what they can
absolutely
do.
amazing. Yeah.
And then you reassure, you apologize, you said that, and then you need to support yourselves, right? So this is a hard job to do. It's very hard to be all the time with a person who actually is depending on you at all times. It's hard. So it's not personal, remember that. So if they are telling something to you about you, it's not personal. They might not, they don't, most of the times they might not even mean it, because it's which part of the brain is damaged. You don't know, right? So some parts of the brain are damaged and then tact is gone. Tact is gone. So they will tell you you're short, tall, fat, thin, whatever. They don't care. One of my clients used to tell me to go to the person opposite to ask them to stop having sex. They were not having, we couldn't even, I'm sure we couldn't hear anybody because they were like literally walls, but she was thinking that and said, you need to tell them, she was 100 years old, she would never speak like that, a very respectable lady. She would, but this is what dementia is doing, so we need to see that. Adapt to the person's new routine. They will not go back to what they were doing. Accept it. Understand it, adapt the environment, your routine, their routine, not yours. You don't have to do anything really. Get some respite. Nobody can do this for a long time or forever. We as care professionals, I mean, I used to do live-in. I used to do 6 weeks on, 2 weeks off, and even when I got back from the 2 weeks, I still needed rest. Nobody can, and you are doing like every single day of your lives, you have your mind on somebody else, you know, what are they doing, are they okay, are they good, all that. So you need respite. You need to have somebody taking your place, even for a while. You need to do that. We do that all the time for people because they need that break. They do need a break. Everybody needs a break. You don't have to feel guilty about it. This is your life as well, right?
And then suppose if they say, I don't need help and I just want to stay.
Because you ask them.
Okay.
You ask them, do you need help? What do they say? No.
Nope.
No.
Do you need a carer to come here?
Yes.
No.
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 Do you need my, your sister-in-law to come here? No. But if you tell them, okay, so tomorrow I'm leaving, but, what's your name, sorry?
Vicky.
Vicky is coming, and she will be with you for 2 hours. Oh, no, blah, blah. And you say, I have to go, I'm sorry, because it's very important, I really need to go. I will be back though, don't worry, I'll be back, I'm not leaving you alone. This is Vicky, this is what she will do. Come on here, Dad, let's show Vicky. Blah, blah. That's how you do it. You just go on talking and suggesting, all right?
Sorry.
Try, yep.
So some of them might not be able to have care in the home. They might have to take them to a care facility for
Yes,
a
they
couple.
do.
Same
Yes,
type of
respite.
thing.
Anyways,
Settle them in.
Yes, settle them in. Settle them in. You need respite.
But if someone doesn't like change, how do you introduce them to something like respite?
So,
It's going to be a
Yeah.
so if yes, exactly. If you take them to a different environment, that's a massive change. Yes. But if if they stay where they are, that's less of a change. But if you don't have any other options, you yourself need to also protect your mental health.
Oh, absolutely. But how do you introduce them to the concept of, say, a day centre or
Overnight care. Yeah.
So how you do it is, you know what? I have arranged tomorrow for you, or I have arranged today. So Claire is coming, and you are going to that because I understand you need to go out, have a coffee or something. So we've arranged, and the taxi is coming to pick you up at 10 o'clock. Let's get ready. Get them ready. Because going out will do them good as well.
I guess giving them some comfort items and
Yes.
familiar things to have around them would help.
Yes, and usually if you can have people like whom you introduce them and then they get to know them, that's easier. You can't avoid some of the discomfort, I'm afraid. We can't avoid it. Try to me, for example. I don't have an answer to that. Because if you know something's wrong, you need to protect everybody and you need to inform the appropriate people.
Yeah, in fact, what he did was
Yeah.
Friday we are going to a group
Yeah.
somewhere in Hayes.
Yes.
So he said, you can sit with me and see how I try.
Yeah.
It's an impossible thing to, decide
Yeah.
whether or not he has got dementia and therefore he's not driving properly.
He doesn't have a diagnosis, or he does have a diagnosis?
He had,
He has.
only recently,
I
about
made
a
so
couple of
many
weeks
people
ago.
But at
cry
that
today.
point, the doctor should have told him he's not allowed to drive, and that's standard from a memory clinic. If you've got a diagnosis, you are not allowed to drive anymore. They notify DVLA actually.
Yes, they do.
So whatever stage it is in, he can't drive.
No, if he's got a diagnosis of dementia, you should not be driving full
Yeah.
stop.
Yeah, that's a good answer.
Yeah.
First of all, I apologize because I made so many people cry today. That was not my intention, but I understand it can be like that because you relate a lot, yeah? Do you have any questions like specific for any specific behavior that you are dealing with that I could help you with right now?
It's a very specific thing. It's a scenario with my mum, she used to sleep upstairs with my dad in her own bedroom. Since she got a diagnosis, we stopped her, made her move her downstairs in a different room, with a hospital bed, and a wet room and everything herself, nice and steady. She never lets go of the fact that, as far as she's concerned, she's been kicked out of her own bedroom.
Yeah.
And she's like, what's going on up there? Up there?
Yeah.
And,
you need to explain every single time, again and again, Mom, you had this incident, so these specific people have said that you are safer down here. This is a bed, this is a hospital bed to keep you safe, and you are here because if you go up and down, you will fall like you did back then, and this caused you to remain in the hospital for such a long time, and it will be very dangerous. So you need to explain every single.
Basically what I do about
yes.
am I doing the right?
Yes. Explaining again and again and reassuring her that this is the safest place for her to be.
Does Dad sleep downstairs with her, or does Dad sleep upstairs?
Because Dad's he used to sleep upstairs. He can go upstairs and stuff, and he's like, it's fine. But now when he started to come and sleep downstairs in the different room,
right?
But because of behavioural changes, that to her that would be no problem. But now it's a case of she's like, I don't care where he sleeps.
Oh, so it's not about Mum saying I want to be with Dad.
It would have been like that before, but with age change, now it's like, oh, that's not my problem.
Yeah.
It's like, where's my stuff and where's my room? What are you not doing up there?
Yeah.
Why are you preventing the access? It's a split. She has it's 4 always like an
Do you have a stair lift in the house?
We have a stair lift.
Then why doesn't she go upstairs?
That's the thing. I'll supervise. I have to get her to use the stair lift. Therefore, on the code, I've tried to use it once or twice, and she did things like she has to take shawls or things with her. She got those tangled up in things like that.
No, so she needs to be supervised in order to use that, and you're not always in the house.
I'm not always there to supervise.
Yeah, okay. Well, that makes sense then.
But
That's...
so coming on to that, I've always tackled it the way you're saying, so this is why you
Yes.
downstairs. But should I be, this comes down to like opening that kind of door, I was like, if I start taking her upstairs more often, just getting her in there, what she then does is she goes like, right, I'm in here, I want to enter all the cupboards now, and I want to do this and I want to do that. It then balloons to be something massive, and then it's like, I'm not leaving her up here.
Yeah.
So I try to not get her up here.
Yeah.
Is that again the right
Well, if it's not safe for her to go up and down, yes, that's the right thing for you to do. If it's not safe, that's the right thing. She needs to remain downstairs in one ground floor. As dementia progresses, mobility changes immensely, I would say.
We're actually planning for Mum to move in with my sister and her partner because she'll have a bit more support there. They're both in the house all the time, and the facilities are better for her. I have told her this is going to happen, probably at the end of the month, hopefully, if they get the bed and everything. She's actually remembered, I think once when she was a bit annoyed with me, she said, when am I going? You're horrible, to me. So,
Yeah.
So is it something I should try and kind of instill in her regularly?
No.
No, just leave it till it's going to happen.
Because it won't be getting and then remembering, and then it's frustrating because she doesn't understand why she has to move. And you explained that again and again. So you explained there are more facilities there, Mum. That's why you're going. It's not that I don't want to care for you, but it's not possible for you to remain here for this reason, and you need to keep telling that. There's nothing else you can do.
So to keep just reminding her.
If she asks you,
don't
bring it up.
Yeah.
If
she asks you, if she remembers that, you explain.
Yeah.
But if you keep reminding her, it causes more frustration.
That's good. Thank you.
It's about the person talking to them and letting them know they have dementia. My mum is like, she knows it, but then she doesn't.
Yeah.
It comes and goes.
Yeah.
There's two elements to that. One is about myself, and when she raises it and goes, I heard something again, someone saying something about me. A, how do I handle that situation?
Yeah.
And B, the second one is like with health professionals, like if I go to a specialist or something, ask for an appointment. I've actually had, because the way I used to do it was like, I was like, talking about work, I don't want to keep bringing it up at work because it's like almost like trauma, right? So I tried not to do bring it up. But then health professionals a couple of times have gone, sorry, you can't not tell her. I'm going to tell her.
Yes.
You need to stop, okay? And then they forcefully tell her, like, you've got dementia, and I can see, and then they go home, and then she's like, so, you lied to me, don't tell me this stuff.
Yes, definitely we need to tell the healthcare professionals that your mom is living with dementia. Yeah?
They know.
If your mom asks you, why did I hear that? And you say, yes, mom, you were diagnosed with dementia on that year. And since then, you live with dementia, which is fine. It's absolutely fine. Nothing changed. Just your memory, you don't like exaggerate things because you don't need to. You don't need to exaggerate things. It's like any other condition. You wouldn't exaggerate things. You wouldn't say, oh my God, you've got, bladder cancer. You wouldn't say that. You'd say, it's okay, we can deal with it. We will try.
We're managing.
We will make it work. We will try our best. You wouldn't say that, would you? Then why would you say something different for dementia? You shouldn't.
Something more specific, like when the doctor, for example, I try saying is like, don't unnecessarily, like if from nature to me and say like, just mention.
It's because some healthcare professionals, they don't know how to, suggest something to them, but then again, you only need to mention it once to them. They don't have to go to the person and say, oh, you're living with dementia. That's that's not necessary.
That's what I find they do.
Yes.
I do
You,
like how you do
you
that, but
can't.
there is
That's
something-
why we avoid. We try to manage everything before it needs for the person needs to go actually to the hospital. We try to care for them. Anything else?
Recording of what you've also said, is it available on any?
I didn't record anything. It's
It's
Mrs.
mine. I'm
Simon.
keeping it all to me.
Yes. Yes.
I'll try and do some editing and we'll share what's relevant. And hopefully Pashalina will be so kind as to give us the slides.
Yep. Any other questions? Yes?
Mum sometimes cries, which I think she knows something's wrong with her, but she can't explain.
Yeah.
So that's normal, isn't it?
Well,
She doesn't
everything is
leave
normal.
us. She knows that something's happening. She doesn't leave us, and she gets diagnosed.
So.
She doesn't know she's got dementia. She doesn't understand it at all.
Okay.
It's just that she
Gets upset, yeah.
So maybe she's dealing with depression. Maybe. A lot of tears. A lot of tears might be depression. Most of people living with depression and dementia go underdiagnosed for such a long time that when we actually diagnose them, it's a bit
Too late.
further on in the condition. But if she's crying and everything, you just reassure her, just say, "You're safe, Mom, I'm here." And anyway, we discussed about it. Dementia is a life-terminating condition. It's actually the number one worldwide, definitely number one in the UK. Cancer is after that. It's hard to capture that, right? Because you say, well, it's just a memory, it's not just a memory.
What is the average lifespan of someone?
8 to 10 years, 15 years if they are
From diagnosis?
from the minute they no, because diagnosis might be later in the life. So from the minute they start the symptoms, having the symptoms, 8 to 10 years, that's if they are like surrounded by good relationships, in a good environment, eating well, exercising, all that.
Can I just ask the same question? You said that you shouldn't contradict them, you shouldn't correct them. I had an incident this morning, and my husband has this issue. We used to sleep upstairs, for many years we sleep downstairs. They still say, like, when I came downstairs today, or I brought this down. I mean, I try not to say anything at that time, and then I'll just ask him, like, where do you sleep? Just to get him orientated to the fact that you don't want to go upstairs.
If
don't live upstairs.
if he's able to answer that question, where do you sleep, and he says, I sleep down here, that's fine. But if you realize that he's not even able to answer that question, you don't need to ask that question. If he says, I came downstairs, I mean, that's a minor thing, really.
Yeah, agree with him.
Just don't say anything. You don't have either to agree or to. It's a CIA. I do not agree or disagree. Like, yeah, literally like that. You don't have to. Just let him say it. You don't have to actually say no. You are always sleeping downstairs. But if you ask him, where are you sleeping, and he says, I'm sleeping downstairs. Yeah, fine. If he can. Not all of the people are bad with questions. Some of the people sometimes are very good in answering those questions. What they want to do. You wanted to ask something.
Why nowadays there is so many dementias coming?
Because now we have the means to diagnose them.
Okay.
Because they used
Because
to say it's
5-6
old age.
years ago we didn't hear about this thing.
Well,
it was
suddenly
still there.
After
we did. For many years, dementia is like top.
Yeah.
Okay.
Yeah, and it's an aging population, so people live longer now.
Mm-hmm.
They used to die 70 years old. Now they live 90, 100, right? So if you live longer, after the 80 years, you have more chances of having dementia symptoms. If you live less, and that's why women are mostly likely to have dementia. We outlive them. We are, stronger. We live longer. So most females have dementia because they live longer. That's the only reason. No other reason.
Just something else to look forward to, guys.
I suppose just try and keep yourselves well. I mean, we're all thinking about ourselves, aren't we, as well? And trying to keep yourself active, connected, doing stuff in the community. Yeah,
Yes.
a lot of people do, but just, you know, to try and protect ourselves as well, it's very important.
Have yourselves involved in as many activities as you can, either in the house or outside in the community. Go to church, go to social meetings like this, meet friends, have friends coming in, or go to friends, go out for coffee, go to whatever you like art or whatever you believe in. Go to those places that you feel comfortable being at, and with people that you feel comfortable. Like,
It's not selfish putting your needs high.
it cannot be selfish. It's like when you're on a plane and you have your small child, yeah? You have your child. And what do they tell you? You put the mask on first before you put it to your child. Why is that? Because that's where the guilt comes in. Because you feel guilty, but you're actually doing the right thing for both of you at the moment. Because if you protect yourself and your mental health, you are able to care for them for a longer time. Yes, please.
Yeah, I think what you're saying is right. It's like me, I'm a priest here.
Yes.
And I have so many people I look after and all that. But I have to go away to also look after myself.
Yes.
Because when I stay here, you are always dealing with different emotions.
Yes.
People who are happy,